I was talked to Gene this weekend, and I know he'd been getting some really good results.
Yes.
And I asked if Gene would just come and say a couple words about when he had the procedure and how it's helped you and how your life has changed. So go ahead, Gene, it's all you.
Okay, well, tell you where it started. In 2005, I lived in Tennessee and was cutting down a tree for a friend, and we cutting it up in fireplace length. And I picked a piece up that had rolled down the hill and started to turn and go back up the hill. And when I did, I caught my foot in a vine. And rather than just throw it and go with the fall, I maintained my balance. And I heard, it sounded like a gun going off, but it was my knee. My left knee, I had torn cartilage in it. Well, I had pain immediately, and went to the doctor, and they tried all kinds of wraps and anything that Medicare would pay for. Well, see, I wasn't on Medicare quite yet then, but anything that my insurance company would pay for, they tried, and nothing seemed to help. So about a year after that, they told me I needed to go to Knoxville Sports Orthopedics to have them take care of it. And he did a procedure. He did arthroscopic surgery on my knee. And after that, he said that I would have pain for a few days. I had to go to therapy. About my third trip to therapy, they said, we're not going to do therapy on you today. I said, I've driven 35 miles to get here. Why no therapy? He said, I think you may have some blood clot problems. So my wife called my lung doctor, and his receptionist basically flipped her off. So she called back a second time, and she said, is there any tests that can rule out blood clots? And she said, if you can make it to the hospital in the next hour, we'll do some tests to see about that. So I went to the hospital, walked up 2 flights of steps. We got up there, and they said, just wait here, we'll call you. So they called me. I walked back with a nurse. They ran this test and got a wheelchair and told me, don't move. Said, still, you've got blood clots in your lungs. The lung doctor said 2 days, he didn't know if I'd go to live or not, but overcame that and went back to see the sports orthopedic doctor, and I thought he was going to cry. I mean, he looked like he was ready to shed tears, and I had to comfort him. But he said he wouldn't do anything more on me. He said he got into that type work because he didn't lose patients, and he couldn't stand to lose a patient. What he had done, he had punctured holes in my bone so that his stem cells would come out and regenerate the area. It didn't work. And anyway, a year later, I had to go to Kettering, Ohio, Kettering Hospital, and I had a knee replacement. They said, that'll take care of the pain. That was in 2007. And until about 2 months ago, I still had the same pain I had originally. And I saw a doctor in Kettering in April, and I told him, I said, why do I still have this pain after having the knee replaced? And he said, where is it? And I showed him. He said, well, that's not the knee, that's a tendon. So my insurance company spent over $30,000 for a knee replacement, plus I don't know how much on other things, and it was for no good. You know, did nothing for me. So when I came here and heard about the stem cell stuff, we had heard about stem cells when we lived in Tennessee. There's a friend of ours down there that had stem cell therapy, but it was the kind where they take the fat out of your body and mix it and all that. And she said, it's very painful, but she said it really helped. So we started saving our money to be able to afford that this year. we heard about it here and came down and saw the benefits of the younger stem cells. I'm 75 years old, so I'm just about on the bottom of that chart. So I thought, well, young stem cells might be just the answer. So September 30th, I went to Red Bank Road and had the stem cells injected. 2 days later, I told my wife, I said, that pain is gone. 2 days, the pain was gone. Up until that time, if I went down the basement, I'd step down with my right foot, bring my left foot down, step down with my right foot, bring my left foot down. Sunday, our son, our oldest boy, he was 52, he was at our house Sunday, and his mom said, I want you to go down the basement with me, I want to show you something. And I said, Terry, I said, let me go first, I'll show you how things used to be. And showed him how I used to go down the steps, and then I took my hand off the handrail and I ran down the steps. Couldn't hardly believe it. And he comes down the way I used to. 52 years old, and his knees are in worse shape than mine. We had a friend 2 doors down from us that had siding damage on his house where it had the grill up close to the siding and it melted the siding. My wife and I used to do siding work, and I told him, I said, I'd like to replace that for you. He said, have at it. So to match the siding, we went up to Menards in Dayton, and the guy said, well, to match that, we'll have to take that up on the 2nd level. You can come up with me if you want to. And he took off running up the steps, and I just took off after him. Got up about 15 steps, and then I realized I hadn't even touched the handrail. I very much recommend, if you're having a problem like I was having, stem cells will help. Now, I told my primary care physician today, I had an appointment this morning, I told him what I'd had done. He said, I'm hearing good things about that. He said, it doesn't work for everybody. I don't know what does, but he said it doesn't work for everybody, but I've not heard anyone getting hurt from it. He said, if it doesn't help, don't know what happened, but he said that it's still new, they're not doing it yet. But I'm very pleased with I've had surgery so many times. When I had the knee replacement, I had that done at Kettering Hospital, and for 2 days I couldn't get out of bed because of the what they gave me to put me out, I guess. I really don't know. But then they transferred me to Otterbein Nursing Home, and I spent 30 days in a nursing home getting therapy on my knee. And I know that the therapist there, her motto was no pain, no gain. And I had a lot of gain. But I recommend stem cell therapy highly.
Thank you, Gene.